the most accidental moment, perhaps, just to give people a sense of how hard it is to plan things, is I was finishing that master's program, and I had switched from working clinically from working full time to part time. So I was moonlighting and and really didn't have clarity how I was going to combine these two careers into one path. I lived in Mountain View, and I really like to ride my bike. And probably the 100th time that I rode my bike through the Google campus, I said, "Hey, what if Google got interested in healthcare?"
And now, from San Francisco and the UCSF Rosenman Institute, the Health Technology Podcast with your host, Christine Winoto.
Our guest today is Dr. Roni Zeiger, a distinguished physician and technologist with a profound impact on digital health. With a medical degree and a master's in biomedical informatics, Roni has seamlessly integrated technology and healthcare throughout his career. He served as the Chief Health Strategist at Google, leading projects like Google Health and Google Flu Trends, which revolutionized access to health information globally. Roni's journey includes co-founding Smart Patients, a platform that fosters patient support and learning through shared experiences. His current role at GirlTrek exemplifies his commitment to community health and social justice, focusing on increasing life expectancy for Black women by addressing critical issues such as inactivity, isolation, and injustice. In this episode, we discuss his transformative work at Google, Smart Patients, and GirlTrek, as well as his vision for the future of healthcare and the power of community-driven solution. Here's our conversation. Welcome, Roni. Thanks for joining today.
I'm so happy to be with you.
It's such a nice, cloudy summer day in San Francisco, but I'm looking forward for this conversation. I've learned a lot about your work, and I thought I always like to start with your journey, what it takes you to get where you are today.
Well, that's a beautifully expansive question to start with. I think that the way I might describe my journey is partly intentional and definitely a lot accidental. When I grew up, I was a pretty nerdy math science kind of kid. I also played a lot of sports, but in terms of my academic interests, it was definitely in the more hard science kind of things. And I thought I was going to be a molecular biologist when I went to college. Actually majored in molecular biology, but I found it pretty lonely to work in the lab, staring down through a microscope. Intellectually, it was very interesting, but it didn't really make me feel complete. And I grew up speaking Spanish and English. I'm originally from Chile. I grew up in the States speaking both Spanish and English. And so I took a volunteer job as an interpreter in a clinic. This is in Los Angeles, in a clinic for those primarily serving immigrants from Central and South America. And I loved experiencing the combination of science and people and humanity all at the same time. And so I ended up going to medical school. My first day in medical school, this was at Stanford, I felt like I had gone back in time because I grew up in Silicon Valley, and I felt like I was very surprised that I was being asked to memorize so many things when I had a Palm Pilot in my pocket. And so that was a little bit of a struggle, but it was also an opportunity because I kind of became the person that everyone seemed to come to say like, hey, what tools should I use? And hey, maybe you could give a talk about this topic because you're always looking at different kinds of ways that technology can improve education. And so I sort of accidentally developed a specialty in biomedical informatics, even though I didn't know that it was called that at the time. I went through my training and did primary care internal medicine, residency at UCSF, as you know. And I practiced primary care and urgent care for a couple of years But I missed all the side projects that I got to do during my training that were related to technology, and was trying to figure out, like, how do I combine my general medicine and public health interests with these new tools that exist. And so I ended up going back and doing a master's in biomedical informatics, which was really just an excuse to take a step back and think, take a bunch of computer science classes, because I had never had any formal training in computer science. And then the most accidental moment, perhaps, just to give people a sense of how hard it is to plan things, is I was finishing that master's program, and I had switched from working clinically from working full-time to part-time. So I was moonlighting and really didn't have clarity how I was going to combine these two careers into one path. I lived in Mountain View, and I really like to ride my bike. And probably the 100th time that I rode my bike through the Google campus, I said, hey, what if Google got interested in healthcare? And with a lot of privilege, I got myself through my network, got myself invited to give a talk at Google. And kind of as I hoped, they offered me a job. And the adventure has evolved since then. But that's a thumbnail sketch of the main part of the beginning of the journey.
Do you think that you convinced Google to be interested in health from your talk?
No. I had incredibly lucky timing. Google had a couple of people quietly beginning a health team. I ended up being the third person on that team, the first clinical person. And it was also lucky that I had a lot of interest and some experience in information retrieval, or put another way, the use of technology to organize and understand and help people find relevant content in the context of health. And of course, one of the ways that Google initially thought about health was, if and how should we look about health content on Google differently than other content? And so I was a good fit in that regard as well.
Mm. And looking back now, seeing what Google has done, how has that evolved since when you just, number 3?
Oh my goodness. I think that, when I started there, which was late 2005, almost 20 years ago now, that's hard to believe. It was a company that was starting to realize that they should invest more in some vertical approaches to information, because they were beginning to plateau their most general purpose approaches. So if you think about it just from a search perspective, it makes a lot of sense for Google to primarily improve search algorithms in a way that will work in a domain agnostic way, that will work for any kind of query. But when those approaches start getting harder and harder to make a difference because you've been doing it so well for so long, then it starts to make sense maybe for the top half dozen verticals, say, let's invest in some more domain-specific approaches. So that's where it was then, as well as some interest in personal health records and just the beginnings of interoperability and the legal and technical ability for patients to access their own health data and potentially organize them in one central place from which they could subsequently share them with autonomy and privacy in mind. So it was a very exploratory time. And fast forward almost 20 years, now Google's focus is much more enterprise software focused on cloud infrastructure and AI as applied to healthcare. So feels like a couple of generations have gone by in between.
And looking back, you think that, I'm sure the team has changed and evolved. Is that, did you ever imagine this is where it will land to?
No, I didn't have that much vision. or imagination. I also was and still am much more interested in the patient or user or consumer facing side of things. And personally, I'm a little bit less excited about enterprise solutions. Feels like, to me, that feels like there's just more room for creativity and good troublemaking on the bottom up side. Of course, business models in general tend to be better on the scaled enterprise sides where there's deeper pockets. And so unsurprising that, a big company ends up finding that focus.
And the question is always, how do you unlock that and bring it to more on the consumer facing side without being the enterprise? So that I think that you see more impact in a way, but then nobody wants that.
Well, it's similar to the question, you're reminding me of the question, which is of course not a binary, but might you prefer to work in a startup or work in a big company with a lot of reach? And it's sort of like, think about it in terms of making progress on a ship. You might have a really big ship with an incredible motor, but if you're on that ship, you're not going to have that much control of the steering wheel, likely. And so you can go really far, but you can't diverge too much from the current direction. Whereas with a smaller organization that certainly if you started, but even if you join it, you will have a tiny motor, at least for a long time, but huge amounts of flexibility in terms of how you maneuver the ship, which is of course really, really fun and interesting.
Do you think when you were at Google at that time, in a way for that department, it was beginning. So in a way, it's kind of funny, interesting position that it's a small, but within a large ship.
Yeah, in a way, at that time, it was the best of both worlds.
Yeah.
It was, I really
Unlimited
do feel like
savings account.
To some extent, yes, certainly less limited than in most other settings. And, I feel so fortunate. Of course I got to participate, but I also feel like I had a front row seat to a really interesting time in history, which is a blessing.
What did you learn from that experience that you brought to when you start the company, Smart Patient, and run that company?
Yeah. Well, my first year at Google, I was pretty clueless. I mentioned that I gave a talk there and we started talking about me working there and they offered me a job and they said, we'd like you to be a product manager. And I said, okay. But then I had to go and ask people, what's a product manager? I really had no idea. It was my first non-clinical job. And the learning curve was really steep. It was kind of like internship, but in a super different context. And so there was a ton of learning about how to build things at scale in highly cross-functional contexts with complexities ranging from technological challenges to social and legal context to figuring out how to get resources in a resource-rich but still complicated organization. It was easy to get a laptop. It wasn't easy to get an engineer, right? And so a lot of it was just adapting skills that I learned during my medical training about getting things done in a complex context to a new context. And that took a little while, but it was fun, and the skills are actually remarkably relevant. And then I think it was really about getting a sense. For me, it wasn't that I should have done, a smaller startup-like thing first. It was that I had an amazing experience for 6 years there. I feel like I got to do or try to do most of the things that I knew I wanted to. The things that were coming next in the next couple of years, I was a little bit less excited about. And I had gotten bitten by a bug that was making me obsessed with the role of community and social connection in health. And once I started learning about the way people were finding each other online, especially people with rare conditions who had a really hard time finding people in person, but even people with common things that, they felt pretty lonely navigating the health system, which is not surprising for any of us who have worked in the health system. I really thought that there was a role for social connection and information exchange across patients in a way that the health system wasn't really focused on, mostly because there aren't incentives for the health system to do that. If anything, there are pretty strong disincentives. And whenever I would do shifts at urgent care, I would notice how much we were actually keeping people from each other, not on purpose, but, even something like, you see two patients in a row who are obviously feeling alone and in similar situations. It shouldn't be that hard to say like, hey, are you interested in connecting with someone who's going through something similar? And if both or all parties agree, that should be a normal thing to do. But of course, if you talk about that in the healthcare setting, people look at you like you're a little bit crazy. And so I was excited to pursue that from the ground up and via a small organization, which is where Smart Patients came from.
It's amazing the power of bringing community together. I'm sure you see that. And it must be really rewarding at the same time. Tell us, when you're doing the Smart Patient, what are the things that I thought would be easy? It turned out to be the hardest thing.
Sure. Well, first I should mention that Smart Patients didn't start from scratch. I met one of the pioneers in online patient communities named Gilles Friedman, and he had built an organization called ACORE, which was for a long time had been running listservs for patient communities. And he and I met and hatched the Smart Patients plan together, which in many ways was an upgrade, a technological upgrade now that the web existed, to more, feature-rich, a feature-rich community platform. So I had the gift of not having to learn a lot of the hard lessons of what it takes to create, to nurture the social fabric of a group of people online. I think the challenges were so many and still are. And I think that includes maybe 3 categories come to mind. One is that building great software just takes time. No matter how great your idea is, it's never going to come out exactly like you want it to in the first version or even in the first 5 versions. So you really have to approach it with a spirit of indefinite iteration. And that has to be fun for you. I think it's immensely fun. But it can't be like, I have this thing and I know it's going to look like it. I just need to build it and then it's going to be great. Because there's so much complexity. You have to give room for questions you hadn't thought about yet or dynamics that weren't anticipated. So just building good quality software is hard and fun. The second is that people are really complicated. You might build a platform that's designed to have people talk about, lung cancer and inflammatory bowel disease. But once people are going to get together, they're going to talk about what's most important to them. And that might include many other things that weren't anticipated. One thing that wasn't on our radar initially was because so many of the communities, especially initially, were in oncology, other serious illnesses and rare illnesses, a disproportionate number of the conversations were about clinical trials. Because for so many people, that essentially was the only treatment options or the only next treatment options they had. So we ended up going on a pretty significant detour early on and building a clinical trial search engine, and then incorporating that into the community platform. So the complexity and unpredictability of human needs and human behavior is something that is, a big part of the equation when you're doing something with and for people, which of course is also beautiful and fun. But if you have a type A personality and you really want to be in control of everything, that can be pretty challenging too. And the third thing that comes to mind is how to keep the lights on, how to get funding and generate revenue and do it in a way that feels right to you and doesn't feel like it's a big compromise from a mission perspective or from a duty to the user's perspective or from a spiritual perspective in any way. And, all those three things intersect with each other and make for a lot of fun daily challenges.
And I think with the spirit of doing it with fun, maybe help keep the engine going.
Absolutely. And when you say that, it really makes me think about the team, because I really thrive on that interpersonal energy of working closely with people. And, when you're working pretty much any job, certainly a job that you're intensely involved in, that becomes a core part of your life. And so it needs to be something, if it's going to go really well, it needs to be something that has a significant amount of fun and meaning for everyone.
And I'm going to leapfrog your current work right now is in GirlTrek, which I think, again, is about people, community, everything that you've been working on, and health. Maybe you can tell us a little bit more about that.
Yeah, it's fascinating to reflect on it in the context of the other questions you have, because I've had quite a few pretty amazing and privileges, opportunities in my professional journey. And my current job at GirlTrek is the best job I've had yet. And I was actually taking a little bit of a break. After Smart Patients, I worked for about 4 years at Facebook or Meta, which was another fascinating adventure. And I hadn't taken time off in a couple of decades. And so I was planning on taking about a year off, and a very close friend had started working at GirlTrek, and he first got me to be an advisor to them. And as I started working more closely with them and got to know the team, I basically told them, if you offer me a job, I don't really care exactly what it's called or what you pay me, I'll take it. That's how good of a fit it feels for me. And in the recent years, well, I should describe a little bit about what the organization is about. So GirlTrek, it's two things. One, it's about a 30-person nonprofit organization that started with the two founders, Morgan and Vanessa, when they walked out the door together and decided that walking together is a radical life-saving act that is something that meant that they were taking back control of their bodies, of their health, of their futures. Even something that you could imagine being that if groups of women started to walk together more, they could also take back control of the streets and of the communities and improve them in the way they wanted. And so it's the organization they built over the last 12 years or so, where over 1 million women have followed them. And so there's 30 people on the national team, but there's 1.3 million people on the broader team. And these are women who are self-organizing and walking together to the kind of the high level theory of change is that we walk, talk, and solve problems together. And what happens is that we can then use that approach to address what we refer to as the 3 deadly I's, which are inactivity, isolation, and injustice. And so for me, going back to like why when I started getting involved, I was like, okay, this is the most beautiful opportunity for me that I could imagine. Is I had been thinking over the last several years, I wish there were a way that I could combine my skill set with my emerging passion for social justice. And because my skill set is kind of specifically in the health field and relatively technical, those two things felt relatively separate. Of course, conceptually, there's a lot of overlap, but in a practical sense, they felt separate. But this has been, I feel like a kid in a candy store, because there's been this incredible work that's happened over the last decade to build this rich culture with a community of 1 million Black women. And while they've talked about building some technology like an app for the members, they haven't had the bandwidth or the resources to do it quite yet until now. And so, again, I feel like I have kind of like when I was biking through the Google campus, I have ridiculously fortunate timing that I have some of the skills that can contextualize the genius that is on that team into, efficiently putting together software to serve the movement. And so I joined full-time in January of this year. And on June 19th of this year, we launched the first version of GirlTrek Underground, which is going to be, which is becoming, it's version 1, but it's becoming a sacred, safe space online for women to walk, talk, and solve problems together. And the mission of GirlTrek initially was to get 1 million Black women walking. When that mission was achieved about 2 years ago, the team went and asked the community, okay, what should we do now? And the result of that listening exercise and a lot of hard thinking was the new mission, which is starting in 2025, we are going to increase life expectancy of Black women by 10 years in 10 years. And anyone who knows a little bit about public health knows that that is a beautifully audacious goal. And we will need to do a lot more than loosely organized walking groups. So we're now just beginning to build the infrastructure to get a lot more organized and to get a lot more women walking and walking together. And then we can also start to layer in a lot of different kinds of programming to address other aspects of inactivity and isolation and injustice, and both at the individual level and at the community level, improve and increase life's quantity and improve its quality.
Yeah. No, I think that's amazing. When I read about it, I thought that this is really cool because, again, the isolation, the health part, the justice part, that's when I'm kind of like, how is that?
Yeah, well, so you have to ask the community, right? I'll give you an example. There are a lot of places where people in their communities wish they could walk, and there are no sidewalks. Or the sidewalks are totally overgrown with weeds that there aren't currently resources to manage. Or there are places where people really, really are trying to eat better, but it's really hard to get affordable fresh food. And of course, there are things related to voting access and overuse of incarceration, surveillance to address problems of public safety when the root causes are things related to people having enough food or having good shelter, etc. So there are so many dimensions of injustice that I think in many ways, especially those of us who are more privileged, kind of assume that the state will take care of. The biggest victories in justice in history have been when people have voiced what they need, demanded it, and insisted on getting it by organizing with each other, figuring out what needs to happen, and doing power mapping and building campaigns. And so when you think about that approach of walking, talking, and solving problems together, it's not hard to imagine that a group of women might be walking together, and as they walk through their neighborhood, they start planning which of the problems in their neighborhood are most important to address and how would they like to address them. And you can imagine a national organization building tools and strategies to empower those groups of women to get things done.
It's almost like it's a city that you're building with all these people living in that platform.
Yeah, I think about it almost as a world, right? We're in a time in history, I think, that is really asking us to use our imaginations more ambitiously. And there's a lot of resources going into, building, augmented reality enhanced worlds for entertainment and maybe for business. And I think that a lot of us really need to be using that imagination and corralling those resources to imagine a more just world in real life. And I think those things are totally possible with when the right people use their imaginations and we give them the resources to make those imaginations real.
Yeah, no, that's really, we are on the same mission here. Because I think that's so important. I want to ask you, now you just joined, in a ways, you're a new person into the organization. What are the things that make the organization so successful in mobilizing people? Because, to get out of your house, to walk, like you said, people are complicated. Behavior is not easy to convince, but obviously GirlTrek has successfully get a large number of Black women together. What are the three key things that you think that make it so successful?
I think that, this movement is so organic. It started with two brilliant Black women and has grown from there. And, most of the people on the team are Black women. There's a few allies, including me. And so there's a deep lived experience of understanding the context that so many Black women are living in. And an organic, thoughtful, iterative process of building and organizing with those women. And so it's less about, following some list of best practices in digital health and much more about authentic relationships. I think that's one key thing. I'll share also that for me, I mentioned earlier how important it is to have, fun and meaning at work and in relationships. I've never experienced a work context that has so but so consistently, everyone that I work with shows up authentically. And it almost sounds cheesy saying that, because I've been in the corporate world enough to have heard and be a little bit cynical when people talk about, showing up as your true self at work, because most of the times that I've heard that, I think it's been not completely honest in the way it's presented. It's more about HR tactics and employee retention than it is about, deep life relationships. And the character of the people that work at GirlTrek, and the culture that's represented there, and the way people relate to each other is more real and provides more meaning in my life than anything that I've experienced before. And so you can imagine what that does to the motivation and the quality of the work that results from people working together with those relationships. And maybe the last thing, okay, maybe it is 3, like you suggested. There's a really exciting, sobering, and motivating urgency. Black women are dying faster than almost any other category of people, even though some of these categories are a little bit arbitrary, I realize. There's a real visceral understanding that we need to follow what we refer to as the Tubman doctrine, after Harriet Tubman. And the first part of the Tubman doctrine is first save yourself, never ask permission to save your own life. And this community of Black women understands that A, they are dying faster than they should be, and B, that they are the ones that need to change that with help, to be sure, with lots of collaborations, with lots of resources, with lots of support, but it's not going to happen by itself without Black women leading the way.
Last question. One of the things, I'm reading this book called I Never Thought of It That Way, and it's a really interesting book. And it gives me so many different perspectives about how to see, to hear, talk to people come from different perspectives. And one of the questions that I want to ask you is there a moment that you remember that you said, I never thought about it that way, when you work in the GirlTrek, that kind of changed your perspective, or it strengthened your perspective?
What a beautiful question. I feel like that happens to me every day.
That's good.
So I have lived in a world where most of my work has been either in institutions or in corporate offices or online. And one thing that I had not experienced very much as a core operating principle is working door to door. And when, for example, we had a retreat, we have a southern headquarters in Montgomery, Alabama, at the old Bricklayers building, which is a historic building and was Dr. Martin Luther King Jr.'s office, his headquarters in Montgomery, for example, during the bus boycotts. And that building was for sale, and GirlTrek bought it to become the southern headquarters. And we were there, and one of the things we did as a team is we went through a couple of neighborhoods and walked down each street and knocked on people's doors to introduce ourselves and tell them what GirlTrek was about and ask them what they needed and how we might support them and what we should learn more about the community. And, I think before I would have thought, like, that sounds wonderful, but it's so hard to scale. But for the kind of work we're doing, there's no other way to do it. You have to meet people where they are. You have to show them that you are actually present in their neighborhood. We need to find and collaborate and maybe even encourage leaders in each of those neighborhoods to start walking crews. And all the work is going to happen locally in neighborhoods. So we have to show up that way as well. And that might mean it's going to take a lot more time and a lot more resources. And then we're going to have to adapt to those requirements. And get much more creative about how we recruit people and the kind of tools we create and how we do fundraising and how we motivate people who maybe don't think that much about this work to contribute to it, either with donations or collaborations or otherwise. But I think doing the work door to door is something that maybe is a good answer for me too. I never quite thought about it that way.
I can have another hours of asking you all this question because I think I'm very fascinated with your current work as well as your journey. But I have to end our conversation today. But thank you for your time and thank you for sharing your story as well as your insight. And it's been so wonderful to hear from you.
Thank you for asking such thoughtful questions, Christine.
Thank you for tuning into today's episode of the Health Technology Podcast. We hope you found the conversation insightful and inspiring. If you enjoyed this episode, please take a moment to subscribe, rate, and leave a review on your favorite podcast platform. Your feedback helps us continue bringing you the latest in health innovation. Stay connected with us on LinkedIn and Twitter for updates on upcoming episodes and more. Until next time, keep pushing the boundaries of what's possible in healthcare. I'm Christine Minato, and thank you for listening.